One of the interesting things about COVID-19 is the way it forces us to ask the question, will we ever learn? And what comes to mind is the following. Last week, under the radar, kind of subterranean, media coverage non-existent, there's been an intense discussion, an urgent discussion between and among governments over what to do about the request made by low and middle income governments like South Africa and India, to have the protection of patents removed from the World Trade Organization during the course of the pandemic, because patents stand in the way of access to medicine. They certainly stand in the way of low prices, and the low-income and middle-income countries are desperate about diagnostics and therapeutics, and particularly a vaccine. So they're asking effectively to have that provision of the World Trade Organization called TRIPS, trade-related aspects of intellectual property rights, TRIPS, which protect the patents, to have that lifted during the course of the pandemic. Not forever. When the pandemic is over and the World Health Organization has said that the pandemic is over, then you can restore the patents. But until then, the low and middle income countries want those patents removed. Well, what they need is a 3/4 vote of the membership of the World Trade Organization. 164 members, they need 123 votes, and at the moment they're not getting those votes. Why? Because the donor countries, the wealthy countries, say, we want the drug industry to make the profit which they expect, and we also think there's enough flexibility in the TRIPS relationship for you to be able to get drugs at reasonable prices or vaccines at reasonable prices. And the low and middle income countries say that assurance hasn't worked before, it doesn't work now. And the real question about do they ever learn is, why don't they take the example of the early days of HIV, when antiretroviral drugs were discovered to treat HIV? And they were treated initially at $10,000 to $15,000 per person per year, putting them beyond the budget of any low-income or middle-income countries. So what happened? South Africa took the pharmaceutical industry on frontally and eventually won, stretching the so-called TRIPS provisions to the outer limits, importing some generic drugs, doing some manufacturing internally. It was terribly tough and difficult, but they saved hundreds of thousands of lives. And then along came India, the apex of the achievement, where the government combined with the judiciary to override the complaints of the pharmaceutical industry to say, look, what we're dealing with is global health over private profit. So the generic drug industries, you can make antiretrovirals. And they did. And it costs $350 per person per year, not $10,000 per person per year. And ultimately, those drugs found their way to continents like Africa and have saved millions of lives. Why can't the international community, primarily the donor community, see that if they override patents now, there will be so much greater equity and access across the world? But they don't do it. At this point, I would normally say, that was last week, I'm Stephen Lewis, but I'm saying instead, we are, along with this commentary, distributing a quiz on AIDS, to represent or to celebrate World AIDS Day. The questions are interesting, the answers are fascinating. I urge you to take it. You'll enjoy it. Now it was last week. I'm Stephen Lewis.